Background, urinary tract and kidney infections. Urinary tract infections are common in babies and young children. Sometimes the infection can spread from the bladder up to the kidneys, which is called pyelonephritis. Kidney infections often cause high fever and signs of inflammation. If they are not treated, they can lead to complications, so early diagnosis and treatment are important. Background. E. coli is a type of bacteria that normally lives in the intestines. It can be very dangerous. Most of the time, it doesn't cause problems, but it can cause infection if it enters the urinary tract. E. coli is the most common cause of urinary tract infections in children, which is why it is important in this case. Case presentation. The patient in this case is a 13-month-old little girl who came to the emergency room with a fever of 39 degrees Celsius that lasted for more than 2 days. The fever started quickly, and there were no other symptoms reported. She had no medical problems, allergies, or known exposures. Blood tests showed a high white blood cell count, which suggests infection. The neutrophil count and CRP levels were also elevated, showing inflammation. Blood cultures did not show any bacteria. A CT scan, it showed changes in part of the left kidney, which suggested a kidney infection. Because there was no clear source of the fever, a urine sample was collected for testing. Methods. The urine sample was handled using proper sterile technique. The bacteria from the urine was grown on different agar plates, including EMB and MSA. The plates were incubated and then examined for growth. A gram stain was also performed to look at the color and shape of the bacteria. This testing continued the work that started earlier in the case after the bacteria was first cultured and isolated from the urine sample. The results. After incubation, the urine culture showed heavy growth of one type of bacteria. This suggests a true infection rather than contamination. Seeing only one main type of bacteria helped narrow down the identification of the bacteria. The results on the EMB agar plate. There was a pink color to this agar plate. You cannot see it on the screen, but there was a lot of growth on the plate, and the color was pink, although it doesn't really show up in this picture. It was a dark pink, almost like a purple, and it was used, the EMB is used to grow gram-negative bacteria, so this result showed that the organism was gram-negative. The mannitol salt agar plate, I had issues with this plate. I put it in the microwave and it ended up exploding, so I had minimal mannitol salt agar. So I was able to introduce the bacteria to the plate though, and there was no evidence of any kind of bacteria growing in there whatsoever. And I did make sure that it was spread evenly over the plate. And because there was no growth on that plate, and because it contains a high amount of salt, most gram-negative bacteria cannot tolerate it. So it helped rule out gram-positive bacteria such as staph. Okay, so I did a catalase test and a gram stain test. The gram stain showed that the bacteria appeared pinkish purple and slightly rod shaped. Pink staining means the bacteria is gram negative. This result matched with what was seen on the EMB and MSA plates. When the hydrogen peroxide was placed on the glass slide, bubbles formed showing a positive reaction, and this result supported my identification of the organism. Interpretation. When all the results were reviewed together, it seemed to point to the same conclusion, that the bacteria was gram-negative. It grew on the EMB and it did not grow on the MSA. And the Kirby-Bauer disc test also showed that the bacteria would respond well to the tetracycline. So for me, it just showed that the infection came from what seemed to be E. coli, and that would be the most likely organism. So the final diagnosis was acute pyelonephritis caused by E. coli. Antibiotic testing showed that the bacteria was resistant to tetracycline, like on the Kirby-Bauer disc, and resistance to tetracycline, is common in E. coli. So this did not affect treatment because tetracycline is not usually used in young children. So the treatment would involve antibiotics commonly used for kidney infections in pediatric patients. The expected outcome with early treatment, most children fully recover from kidney infections and from bladder infections. So fever usually improves within a few days, and the goal is to treat the infection quickly to prevent kidney damage. And let's see. So my conclusion is that this case shows how a fever in a young child can be a sign of a serious infection. It also shows how basic lab tests, like we did, can help identify bacteria and guide treatment. This case combined microbiology lab work and linked it to real patient care.